Good morning. We're here to give an update on COVID-19 in Oregon. I'm joined by Dr. Peter Graven, lead data scientist at the Oregon Health and Science University, Mariana Robbins, a 15-year-old with long-haul COVID symptoms. She has a very important story to share with you all today. Thank you, Mariana, for joining us. Dr. Dana Harganani, the Chief Medical Officer at the Oregon Health Authority, and Dr. Dean Seidlinger, our state epidemiologist. I want to start with addressing the 15 counties that are entering extreme risk today. Moving any county into extreme risk is not a decision we take lightly. That's one reason why, a few weeks ago, we updated the state metrics to require that hospital capacity be a tripwire to cross before reimposing the extreme risk rules. But here's the reality Oregon is facing right now. Cases are widespread, driven by new, more contagious variants. Oregon leads the nation for our rate of increase in cases over the last 2 weeks. In fact, this is the 5th straight week Oregon has recorded case increases of 20% or more. Our hospitalizations have nearly doubled what they were a week ago. While fewer seniors are being hospitalized, thanks to vaccinations, COVID-19 is now knocking more younger people off their feet. The portion of hospitalized cases of people 18 to 34 has increased by almost 50%. I was presented with data showing 2 paths Oregon could take. One in which we took no additional action and stood by while more people die from this disease, or another that required a temporary tightening of restrictions for certain counties, but could save hundreds of lives and prevent as many as 450 hospitalizations over the next 3 weeks. As your governor, I chose to save lives. I've invited OHSU's Dr. Peter Graven to share that data with you because it is truly eye-opening. And I recognize that this puts many Oregon businesses and working families in a difficult place. So I've worked with the legislature to secure $20 million in urgent relief for Oregon businesses impacted by extreme risk. We can get this aid quickly in the hands of our businesses, and I encourage all impacted businesses to apply for assistance. Economic relief is something I can do as your governor to help Oregonians impacted by this 4th surge. What I can't do is bring back someone's life lost to this virus. That's why, as hard as this is, we must act immediately. There is some good news. The same scientific modeling that predicted increased deaths and hospitalizations if we didn't enter extreme risk also shows that over the course of the next 2 to 3 weeks, based on current vaccination rates, we can get ahead of these variants. Following that trajectory, we should be able to lift restrictions statewide and return to a sense of normalcy by the end of June. Every time Oregonians have acted to protect ourselves and each other, we have stopped this virus in its tracks. We are asking for your help again today. We know vaccinations are the best way to protect yourself and your loved ones. Vaccinations are the key to moving us out of extreme risk and on a path to fully reopening our economy. We can reopen our economy and move forward to post-pandemic life in June, but it's going to take each and every one of us to do our part to get there. Certainly every day we're making progress. More than half of adult Oregonians received at least 1 dose. We're averaging close to 35,000 vaccine doses administered per day. So if you haven't been vaccinated, please do so now. There are many available appointments statewide right now. And if you still have questions or concerns about the vaccines, please ask your healthcare provider. You can also call or go to covidvaccine.oregon.gov for great resources. If you've already been vaccinated, thank you. Now, please help your friend, neighbor, relative, or colleague make an appointment. I also recognize that access to a vaccine isn't the same for every Oregonian. We're doubling down on our efforts to reach every Oregonian with a vaccine and information, especially those who have a harder time accessing mass vaccination sites or online appointment portals. We are not out of the woods just yet. There are better days ahead. Let's keep our eyes on that horizon and let's move Oregon forward together. And with that, I'm going to turn it over to Dr. Peter Graven.
Thank you, Governor Brown, for having me here today. Good morning, everyone. My name is Peter Graven, and I serve as the lead data scientist in OHSU's Business Intelligence Unit, which means I use data and study trends to forecast health and operational outcomes. Compared to other states, the efforts made by Oregonians during this past year has been very effective at limiting the impacts of COVID-19 in Oregon. We can be very proud of that. The data certainly bears this out. I know this because for more than a year, I've dedicated much of my time, frankly, both on and off the clock, analyzing COVID-19 trends in Oregon and across the US to help Oregon and other state hospitals anticipate the direction of the pandemic and the impact of COVID hospitalizations on our state. Working together with our state's epidemiologists and data scientists, our forecasts and weekly data analysis have provided the foundation for Oregon's ongoing policies aimed at keeping the state safe and to stop the spread of the virus. By making data-driven decisions grounded in science, Oregon has been a top performer in its case counts and managing surges during the pandemic. Unfortunately, in recent weeks, Oregon is being recognized for a different reason, having the nation's fastest growing rate of new COVID-19 cases, which leads to why I'm here today. While this is a scary sounding data point, it's important to know that we turned the virus back in the fall by reducing our activities. And because of it, we had one of the lowest case counts in the country. We already know this policy is effective when our Oregonians put their minds to it. Our modeling, which you can see in a brief available online, is currently measuring the rate of Oregonians getting vaccinated, how much variant are present, the number of previous infections, and the effectiveness of engaging our state's risk level framework. The good news is, when we pair these data together, it shows us that we have just 3 to 4 more weeks until we are in good shape. That's when cases will fall and our vaccine levels will be high enough that with basic preventive measure, the virus cannot effectively grow. Following the risk level policies for those counties in extreme or high risk is another huge sacrifice. But if we can follow a short pause in those activities where the virus thrives, namely indoors without masks and in close proximity to people outside our household, our modeling shows that it will effectively halt increases in cases and prevent another 176 Oregonians from dying from COVID-19 and over 700 more hospitalizations in total that would occur if we did not follow the risk level framework. As Governor Brown has stated, there is a known and data-informed end date to this pause. These restrictions will be in place for a maximum of 3 weeks, but it will make all the difference in ensuring we protect as many Oregon lives as possible as we work to get back to a safer state where the virus can no longer prevent us from enjoying many activities. Of course, with over half of Oregonians still susceptible to the virus, it's vitally important that everyone get vaccinated to protect themselves and others. But it's not easy, and I'll be honest, eating in our restaurants in Portland and around Oregon is something I'm looking forward to. And even though I have several friends and family members whose income depends on it, I know shifting to outdoor only dining for the short period is the right policy for the problem we are in. We can do it. Thank you.
Thank you so much, Dr. Graven. Really appreciate you joining us today. Next up is Mariana Robbins. She's a 15-year-old impacted by COVID. Mariana, the floor is yours.
Hello, my name is Mariana Robbins. I am 15 years old and I'm a sophomore at Edison High School. I have suffered from post-COVID since September 2020. And for me, having COVID was post-COVID was one of the worst and scariest experiences for me because I was severely affected in many ways. My ability to learn was impacted, my memory loss, dizziness, daily migraines, and the worst pain I ever felt all over my body. It also made my daily life so much harder because I was in severe pain and was sleeping most of my days. For me, the worst and scariest symptom was passing out without warning. This caused me to be scared to even walk around my house. But during this time, my doctors tried to figure out what was wrong with me. Even though I'm slowly getting better and getting back to a normal high school life, post-COVID is still affecting me. It has made it harder to learn and remember things that I used to know pre-COVID. Before COVID, I used to read all the time. Now I can't even read a simple paragraph without getting tired and frustrated. With the help of my teachers and staff, they have been very supportive at my school. After all this time suffering, I strongly urge others to get the vaccine because it can save your life and it can make sure that you and others don't have to get affected the same way and have to suffer like I have. For me as a teenager, I also strongly urge other teenagers to get the vaccine as well because this can happen to you. And in my opinion, COVID is a very serious matter and disease that everyone should care about. Thank you.
Thank you so much, Mariana, for joining us today. My heart breaks for the challenges that you've faced. I'm really grateful you were willing to share your story today. With that, Charles, I think we're ready for questions.
Thank you, Governor. And for the reporters on the line, we'll be using the raise your hand function to ask a question. We'll start with Brenna Kelly with KPTV. Go ahead, Brenna.
Hi, good morning, Governor. Regardless of the number of vaccinations given, when we've reached a month's time after everyone has been eligible to get a vaccine now, at what point do you say you've given Oregonians all the tools and you can't continue to shut down if they don't want to use them?
So my goal in terms of reopening in June, there are a couple of factors that I'm looking at. Number one, want to make sure that we have a solid majority of Oregonians that have been vaccinated. That includes our communities of color, our Latino, Latina, Latinx communities, our African-American communities, our tribal communities. They have all been disproportionately impacted by this pandemic. We need to make sure that a solid majority of these communities have been vaccinated as well. We need to make sure that the vaccines are easily accessible in communities around the state. We expect that will happen in the next few weeks. And then third, we are continuing to watch our hospital bed and staffing capacity. Obviously, this is a concern. And once we address these three issues, I fully expect that the economy can reopen. In terms of the data, it looks like this could happen mid to end of June. But the harsh reality is the sooner Oregonians get vaccinated, the more people that get vaccinated, the more quickly that we can reopen our economy. Vaccinations are truly the key to this reopening, and they're key to protecting yourself, preventing hospitalizations, and preventing deaths. So the sooner Oregonians can all work together to get vaccinated, the more quickly we can reopen.
Thank you.
Thanks, Brenna. We'll go next to Lincoln Graves with K2. Go ahead, Lincoln.
Yes, thank you for taking my question. Governor, this week, 74 county commissioners wrote a letter to you in conjunction with the Oregon Restaurant and Lodging Association, asking for reconsideration of some restrictions. Given all we know, given the fact that we do have vaccinations out there and more coming, why can't decisions about what to do in terms of restrictions be turned over to county governments?
That's a really good question. What I would respond to in terms of the elected officials and businesses is that COVID is surging right now across Oregon. It takes community-wide measures to make sure that we can protect our most vulnerable Oregonians. I certainly am extremely concerned about the impacts to our businesses. And that's why I've worked with the Oregon legislature to get a $20 million funding package that will go out to these 15 counties. In terms of why a statewide approach, it's about hospitalizations and healthcare capacity. And I'll let one of our experts, Dr. Dean Seidlinger, talk about that.
Thank you, Governor Brown, and thank you for that question. I think what we're seeing now is similar to what we saw in the fall. We are seeing an increase in cases across the state, traced to multiple different sources, from social gatherings, attendance at bars and restaurants, workplace outbreaks, and about half of our cases that aren't able to be traced to any known source because COVID is so widespread. We're also seeing an increase in hospitalizations like we saw in the fall, a curve that became very steep and pushed us close to not having the specialized care and intensive care units that every Oregonian deserves, whether they have COVID or a heart attack or a motor vehicle crash. The people with COVID in the hospital peaked at 584 Oregonians in hospital beds in the fall. We are quickly seeing our number of people with COVID increase across Oregon, with 339 Oregonians in the hospital this morning with COVID, and increases of over 30% in the last week. Without taking action, that curve, that number of Oregonians who are sick and at risk for dying would continue to increase. So these measures are designed to help limit the transmission from individuals as we get more vaccines into arms. While they are available for everyone, we don't have a vaccine right now for everyone who would want it, but we're getting more vaccines every week, and appointments and locations for vaccines are much easier to find. So by getting those vaccines into arms, by limiting our higher risk gatherings, and by wearing our mask and keeping our distance for the next few weeks, we should be in a place where COVID is much more under control, and that we won't continue to see the loss of life and people suffering in the hospital that we do right now.
Governor, I had one follow-up question then about that 20 million in aid you mentioned. We've heard from business owners saying they worry that this won't be enough, either for all businesses as a whole or that some businesses would fall through the cracks. What's your response?
My goal is to get these resources out the door as quickly as possible. We are working with the counties. The dollars, $20 million, will be distributed to the counties, and they will make the decisions about how they go to our businesses. I know that our businesses across the state, these small businesses, are truly the heart and soul of Oregon's economy. I'm absolutely committed to getting them the economic relief that they need.
Thank you. Thank you.
Thanks, Lincoln. We'll go next to Lisa Balick with COIN. Go ahead, Lisa.
Good morning. First question for Dr. Seidlinger. In the metro area, it's still difficult for a lot of people to find an appointment. At what point are many primary care providers here going to be able to offer vaccine and office clinics? In other words, what's the time frame as you look ahead as to when that will be happening?
Thank you, Lisa. I will start with a response and turn it over to my colleague, Dr. Harganani, to fill in some details. I know the process of rolling out the vaccine has been frustrating to many individuals, as we don't have all the vaccines that we would have liked from the start. But having this vaccine, which is so safe and so highly effective just a year into this pandemic, is an amazing tool. And to have 3 vaccines that work and are safe and available to Oregonians, is going to help us return to a normal life, allow businesses to operate. And while vaccine numbers have increased in the Portland metro area and across the state, they're not quite where we'd like. And we are working towards getting more vaccines and moving them to primary care. And I'll let Dr. Harganani tell you a few more of those details.
Thank you, Dr. Seidlinger, and thank you for the question. Yes, we are getting closer and closer to a broader distribution of vaccine as we get more of them coming into our state week over week. We have already begun providing vaccine access within outpatient settings like federally qualified health centers, as well as other clinics serving particular populations that we know can have problems accessing vaccine. We are working with our partners in outpatient settings, both in the Portland metro area and broader, to begin getting more and more doses into those settings. And some of the work we're doing right now is really focusing on the logistical side of that. Some of the vaccines are delivered to providers in large quantities. For example, the Pfizer vaccine comes in quantities of 1,100. So we're working to develop hubs where bigger health systems can receive those vaccines, repackage them, get them out to our smaller providers so that access can occur in your primary care setting or where is most comfortable for you. It should be coming over the next 4 weeks as we ramp up this access point.
Is there any plan, though, to move doses from especially the Salem fairgrounds where there's just appointments to be had nonstop, yet people are not willing or able to get down there, to move a lot of those doses back up here?
Yes, thank you for the question. We are actively working on that. As we see trends and slowing down of uptake in certain parts of our state, we're moving doses to where we know there's still a strong demand. And again, in every part of our state, working with providers in the outpatient setting to start moving towards a broader distribution from a more mass vaccination centered approach to more outpatient setting. So all of those trends are happening as we speak.
Thank you, Lisa. We'll go next to Pat Duris with KGW. Go ahead, Pat.
Thank you. My first question is for Dr. Gravin with the Business Intelligence Unit. I'm wondering if you were the folks who came up with the 300 hospitalizations as the tripwire, and if so, how you came up with that number and why that number. And then second, you mentioned that moving counties into extreme risk will basically save 176 lives. How did you come up with that number? And then I have a follow-up for the governor, please.
Yeah, well, I can say, I did not come up with a number for 300. However, if you look at the history of the census, this is almost exactly the same point in the curve before where we announced the social pause and the freeze. So it's in a very equivalent point in the acceleration. So I think you'll see that probably made sense. My guess is, we knew that cases were going to shift to younger people, so we may have higher case counts and therefore less hospitalizations. So it made sense to ensure that we really were seeing that the census was increasing because that's kind of the constraint on the system there. So that question can go back to the governor, but I'll answer your other question first, which is how do we come up with the 176 deaths number? And I think this is important. The path that we've been following, and you'll see this in a brief if you go and click through. We've had a little fear and fatigue wave that's been happening over time, and that's been pretty predictable. In fact, it predicted this spring surge pretty easily. And when you follow that, there's also this fear cycle that takes place, and that's been basically when we've gone and acted the risk level framework. And so normally our policy gets a little stronger as things start picking up like this. So all we have to do is compare what happens if we follow our traditional path with a path where we kind of don't enact the policies. And so for that, there's a metric that you can use to do that, but you're essentially tabulating up the number of deaths that would be predicted to come. And the deaths that I calculate are actually anytime between May 1st and actually through the end of summer, although most of the difference is here in the next few weeks. Does that answer your question?
I think so, well enough, thank you. And then Governor, a lot of folks have been asking, oh, I'm sorry, go ahead.
I just wanted, if someone from the Oregon Health Authority, Dr. Dean Seidlinger or Dr. Harganani can address your question about the 300 bed capacity.
Yeah, thank you, Governor Brown, and thank you for the question, Pat. As Dr. Gravin said, this number looks similar to where we would needed to act in the fall. And that's because we looked back at that peak in the fall. We talked to our healthcare providers. We're concerned that as we are seeing increased cases now, that we might quickly see a following increase in hospitalizations. Knowing that our older population is not as likely to be hospitalized now as they were in the fall because of vaccines, but our hospital and healthcare partners were seeing younger, sicker patients come in. So we looked at that peak in the fall, saw that we had gone up to 584 people with COVID in the hospital on a given night at our peak. So we chose the 300 number because we looked that the increase week over week in the fall ranged from about 16% to as high as 49%, meaning almost a 50% increase in a week. And those numbers happened rather quickly. So we looked to who's in the hospital right now. The transmission where they got sick was about 3 weeks ago. And we know that when we implement measures encouraging people to stay home more, to limit the risk of transmission to others, to get their vaccine, that this will take some time to take effect while we get more people vaccinated. So with that 300 number and the higher week over week increase of 15% or more, we knew that we had some time to implement policies, to have people change their behavior for the short term so that we could prevent getting to that peak in the fall and prevent getting to a place where people might not be able to get the high quality care that they need.
Okay, thank you. And then, Governor, the other question that I had is we've heard a lot of people say, why not leave the restaurants and the businesses open for people to come in and just require the customers to prove that they've been vaccinated? It encourages vaccination and leaves the businesses alone.
I think what I would say is that our vaccine distribution efforts, while fairly effective and efficient, have not been as equitable as I would like. And we are working hard to close the vaccine gaps that exist amongst our communities of color. And we've made good progress in the last 4 weeks. However, we still have a lot of vulnerable Oregonians that haven't gotten a vaccine yet. And as you are well aware, Oregon has the fastest growing infection rate in the entire country. I'm focused on saving lives and want to make sure that Oregonians have ample opportunity to get vaccines. This is truly a race between the variants and the vaccines. As Dr. Graven said, we need a couple more weeks, 3 to 4 weeks, to get more vaccines into arms. That's where I'm focused. There are a number of ways that Oregonians can support their favorite businesses. They can continue to do takeout. There is the option of eating outdoors, and of course, continue to shop and purchase items online. So I want to encourage Oregonians to support their local businesses. I'm doing everything I can to get economic relief out the door as quickly as possible. We want to ensure that these businesses survive and thrive. They're essential to our economy. But right now, I am gravely concerned about vulnerable Oregonians, about our hospital bed capacity and the ability of our healthcare workers to provide medical care.
All right, I'll let other reporters ask questions. Thank you.
Thank you, Pat. We'll go next to Aaron Ross with OPB. Go ahead, Aaron.
Hi, so just quickly for Dr. Graven, just to confirm that I have this correct, that's 176, the model is predicting 176 extra deaths through the end of summer if we were not to implement any changes right now.
Yep, that's correct. But I will say it's primarily in this next month. I tabulated it up for the whole summer, but it's essentially most of the difference between the two policy paths is just in the next 4 to 5 weeks. So they would be concentrated in that period of time.
Thank you. And Governor Brown, given both the data in Oregon and from around the world that's showing that we can't necessarily just put the increase in infections in young people on vaccinations alone, that they are also getting significantly sicker. How is that going to change or alter your in-person education plans, or do you have any changes that you're planning on making?
We are not planning on making any changes at this point in time in terms of our education plans. Schools have been doing a really terrific job around the state, complying with Ready Schools, Safe Learners. What we know now is that the risk of transmission is low if folks follow these safety protocols, and it's critically important for our kids to be back in the classroom, learning from their teacher and their peers. It's really good for their education. It's good for their mental and behavioral health and good for their social development.
What we have seen, though, with B117 is that it is both significantly more transmissible, so it takes less of the virus to get you sick, which means that you have a better chance of getting sick if you're only barely exposed, but also that it does appear to be significantly more severe and severe across all age ranges. So does that raise concerns for you?
Certainly, I'm concerned, particularly about the transmissibility of the virus. I'll let Dr. Seidlinger speak to the severity of the variants. But again, I would say this, the best way for folks 16 and over to protect yourselves are to get vaccinated. It's the best way to protect your loved ones, your family members, and our vulnerable community members. It also helps us prevent hospitalizations and deaths. So please, please, if you haven't gotten vaccinated, please do so. There are a number of resources available. And with that, I'll turn it over to Dr. Seidlinger to talk about the severity of the variants.
Thank you, Governor Brown, and thank you, Erin, for that question. I think with Ready School Safe Learners, we have multiple safety measures in place to protect students, staff, teachers, and the families they return to. We have physical distancing, 3 feet within classrooms under certain situations and 6 feet in other settings. Enhanced cleaning in those settings, especially of high-touch surfaces. Availability of hand sanitizer and to wash your hands. Using masks in those settings and symptom check and other ways to prevent spread of disease within the settings. We have offered on-site testing to schools so that they can test individuals who become sick at school or exposed at school, with about 1,200 schools already signed up for that program. In addition, the adults in those settings, the educators, have been offered vaccine and have taken us up on getting vaccinated, and 16 and 17-year-olds in those settings are now eligible, and we hope soon 12 to 16-year-olds. All of those things will do incredible work against preventing the spread of COVID-19 within those settings, including a more transmissible variant like B117. And while we have seen more cases associated with schools since more schools have opened up and COVID rates have gone up, we still see very limited evidence of transmission within schools in those controlled settings with multiple safety measures in place. I ask teachers and staff in those settings, parents and kids in those settings to think about the activities they take part in outside of there, social activities and extracurricular activities, and do them in the safest way possible, because we typically see spread happening in the community that's brought to the school, not spread happening within the school and brought out into the community. So those same safety measures protect against B117 and other variants, and getting a vaccine protects against all those variants as well. So for students and staff in those settings, they should be getting vaccine when they're eligible.
Thank you, Dean.
Thanks, Erin. We'll go next to Gary Warner with EO Media. Go ahead, Gary.
Hi, Governor. I wanted to find out how you're going to deal with the people who are belligerent against vaccination. We had an incident yesterday out in Bend where there was a high school vaccination event and anti-vaxxers showed up and were heckling the kids, calling them Nazis, calling the people who were giving the shots Nazis. There are going to be more of these events coming up pretty soon. Can these people be stopped somehow as obstructing a public health emergency? What are you going to do on those who are unfortunately out there who want to not just be hesitant about themselves getting it, but don't want anybody else to get it?
Gary, I've spent my entire public service career working to engage Oregonians in the public process. I'm not going to change that stance now just because I might disagree with the message of the messenger. I think what I would say to them, what I would say to all Oregonians is that while I'm governor, and I hope in the future, we're going to continue to rely on science and data in making public health decisions. And I would encourage Oregonians, if they have concerns or questions, to reach out to their healthcare provider to get the information. I'm pleased to hear that there are such broad spread efforts working to get our high schoolers vaccinated. I think they understand, their parents understand that this is how we protect kids from this virus. This is how we protect adults, family members. And then Gary, lastly, I would just ask, that those of you in the media continue to share the story of young people like Mariana. Her story is extremely scary, and I think parents, students across the state need to hear it. But we're going to continue to make policy, health policy based on science and data.
Based on the emergency declaration, is there anything more you can do against people who are obstructing vaccination centers?
We will certainly look at what tools that we have. To my knowledge, there are prohibitions on folks blocking access to healthcare clinics. But as you are well aware, Oregon, along with 47 other states and the District of Columbia, continue to have emergency orders in place, and I expect Oregonians to comply with these orders.
Thank you.
Thanks, Gary. We'll go next to Amy Green with the Oregonian. Go ahead, Amy.
This question is for the governor. Oregon is a bit of an anomaly nationally, with only a handful of states with increasing cases, and none, as you've said, more quickly than in Oregon. OPB asked OHA Director Patrick Ellen on the air this week, couldn't you see this coming? Cases have been rising for 5 weeks, and I was a bit surprised to hear his answer. He said essentially, because of COVID fatigue and public resistance to more restrictions, it was necessary to let hospitalizations rise to a certain point before enacting actual restrictions in order to get public buy-in. My question for you, Governor, is do you agree with that? Can you speak to why you waited so long to enact these restrictions when cases have tripled in the past 5 weeks?
I've been talking to Oregonians every single week, expressing concerns about the growing numbers of cases, and been very, very clear. Should folks, all of us, not take the actions we need to reduce the spread of the virus, then we would be taking more restrictive action. We put the metrics in place based on data and science. We're following those metrics. And I think you have to have some level, some level of public support for these to be successful. What I think is really, really important is that Oregonians be able to get the medical care that they need, regardless of where they live, whether they have a very severe medical event or have an unfortunate accident. I'm absolutely committed to making sure that Oregonians get the medical care that they need.
Respectfully, I don't think that really answers the question. Why didn't you enact restrictions weeks ago? We know COVID cases and hospitalizations they can grow exponentially. You could have potentially stemmed the extent of this latest surge. Were you worried about people not buying in and following the restrictions?
This is always a balance between lives and livelihoods. I think the data shows that Oregon has reached the right balance. And what is different now is that we have the variants in place and we have vaccines. So it is more challenging, frankly, for Oregonians to understand why these safety protocols need to be in place that the pandemic has forced upon us when there are vaccines. And you have the variants that are moving, frankly, at a much more rapid pace. Dr. Seidlinger, would you like to fill in here, please?
Yeah, I think, the balance we've had in fighting this disease has really stemmed, it's not policy that drives the change, it's policy with people following that policy. After more than a year of fighting COVID, we know that everyone is tired. We know that people want to go back to eat, need to grieve with their families over the loss of loved ones over the last year, need to celebrate milestones. And so we've been talking about the increase in cases and asking people to change their behavior. And many people have. The vast majority of Oregonians are doing what they can to protect themselves and their loved ones. But over these next few weeks, we need more Oregonians to join us. We need more Oregonians to make their appointment to get their vaccine. And doing that, we will see cases go back down. we will see hospitalizations go back down, and we will once again be a leader in fighting COVID here in Oregon. Over time, those numbers are some of the lowest in Oregon compared to other states, and we need to get our recent numbers back down. We'd like to be known for successfully fighting this disease and not the state that's most impacted by this disease. And together we can do that.
Thank you, Ivy.
Thank you.
We'll go next. We have time for one last question, so we'll go next to Ben Botkin with the Lund Report. Go ahead, Ben.
Yes, I was hoping either Governor Brown or Dr. Seidlinger, if you could explain what exactly the percentage is that you use to decide when the majority of Oregonians have been vaccinated. Can you give me a specific percentage? Thank you.
Thank you, Ben. The answer is no. What I've said is that we need to see a solid majority of Oregonians vaccinated. And that includes our communities of color, our Latino, Latina, Latinx population, or African-American population, our Native American and tribal people, our Asian and Pacific Islander people. That includes all of these populations that are a critical part of our communities. Dr. Seidlinger.
Thank you, Governor Brown. I think the answer to that question is, as Governor Brown said, is no, we can't tell you a certain number. With this being a new disease, we make some projections that 70 to 85% of people would need to be vaccinated. But every person who gets vaccinated and every percentage we increase the percentage of Oregonians who are vaccinated helps us drive down cases as we get towards vaccinating as many people in Oregon as we can. Having the vaccine available to all Oregonians over 16 and hopefully soon having it available to those 12 and older will help us achieve that. But we need everyone to come together. As Governor Brown stated earlier, if you've gotten your vaccine, help your neighbors and help your friends get the vaccine. If you have questions about the vaccine, go online to some trusted sources, the Centers for Disease Control and Prevention, Oregon Health Authority, a trusted community partner, or call your healthcare provider to talk about the vaccine. Because these vaccines are safe and effective, the more people who get vaccinated, percentage by percentage, person by person, gets us closer to winning the fight against COVID, going back to enjoying the activities we enjoyed before COVID came, and having COVID be a distant memory.
Thank you, Ben. Governor, that's all the time we have for questions today.
Thank you all so much. Please stay safe out there and have a good weekend.